We're here today to talk about what a disc is, how it gets hurt, and what you might have been told in the past about your own disc injuries. The disc is a critical element of movement in our body. It is a stabilizer or a shock absorber. It allows for the fantastic range of motion that our spine has. But when they are injured, they can be very, very painful. But, and here's the weird thing, they can have tremendous injury and have no pain whatsoever. And so we're going to talk about the differences in why you might have pain generated with a disc and why you might not, and why not all disc injuries are as severe as what the stories are. And so what we want to re-emphasize is that we don't have to be afraid of a disc injury, but we have to be after it. We have to treat it. You cannot let a disc sit, because just like any good festering wound, the longer it goes and the more untreated you leave it, the harder it is to get better. And this is a tissue, as we'll talk about, that you want to get fixed. So if we look here first, this is what a normal disc would look like from the top down. We've got somewhat of a horseshoe shape with little rings on the inside like tree rings as they age. In the center we have a bit of a soft core. Behind the disc in the spinal column is where our spinal cord sits, and then we have little nerve roots that go out to the side, and they're the ones that are heading out to move my arm or my legs or feel my skin, whatever it is. In a normal situation, these rings allow for movement and torsion and be tough. But when they start to get broken down, they have predictable ways that they typically break. Because so much of our day is bent forward or looking down, you can imagine that we're going to stress that tissue again and again in one direction. And so when we start to see changes to a disc, sometimes we can see a bulge, sometimes we can see delamination of those rings, sometimes we can see a complete and outright herniation. And so we have variations on a theme here. But what typically will happen is that these rings will start to break. When they start to break, they either will separate a little bit from each other, and that starts to cause inflammation and swelling at the area. And this would be an injury that'd be consistent with, like, you know, sometimes my back hurts or sometimes my neck hurts, and then I get like this butt pain or this shoulder pain. Maybe I get a little pins and needles in my hands and my feet once in a while. It's not major. I can live with it. But what it's telling us is that there are problems at a deeper level. And up to 76% of hip pain can be from your lower back, even if your lower back feels totally fine. And so we want to address these deeper problems because they will keep you away from a surgical exposure down the road. Now, if we go from the fibers separating to more of a bulge scenario, this is a progression where the tissue keeps getting loaded in a painful way. For most people, again, it's flexion. This soft center starts to push backwards, and because it hits a very hard ligament on the back of the disc, that material starts to move to the side, and so typically you'll have pain that goes to one side or the other. Sometimes it can go both ways, but that's usually more a progressive injury. When it starts to go to a side, not only does it trigger inflammation at the area, chemical pain, and that's where if you took like a prednisone or an ibuprofen or something like that, you might feel better, or why in the clinic we would recommend fish oils, natural anti-inflammatories, and laser therapy, because we can target inflammation treatment without the negative side effects. But we get pain because that disc starts to migrate, triggering a chemical reaction, your immune system gets mad, and then we get pressure right on that nerve root. And that's where you might have something like, my sciatica is killing me, or I'm having pain shooting down my arm, or maybe even up the side of my head. That radicular pain is coming because the disc material or the environment is swollen enough where the nerve is being pressurized. And it's almost exactly like if you fall asleep on your hand and you wake up and your hand's numb, the nerve's been compressed. But when it happens centrally, it has all sorts of negative effects with it. If we progress from a bulge to a herniation, what happens is that this inner material, the soft core, gets pushed out so many times that this ruptures, and we get a chunk of material out into the space around the nerve. Yes, this absolutely can be more serious, but many people walk around with asymptomatic disc injuries, and that can include herniations. So while this is often the more scary of the pictures, because this is the scenario that usually people are going to find themselves in front of a surgeon on, this still is a treatable scenario. And we have had many cases where we use a combinations of conservative chiropractic care, the McKenzie method, as we've talked about in other management videos and exercise videos, laser and nutrition, to create a whole spectrum of approach and recovery to something that does not always need surgery. And this can be a scary thing, so you need to understand what is good about this. So what is good about a disc injury? The research shows that up to 80% of disc injuries will self-resolve. That means they're going to go away within 18 months. And where people usually run into trouble is that the first few months when they're unmanaged and you don't have the right care, it's miserable. Like having a disc injury, if you've never had one, it is one of the most debilitating things you'll ever run into. And that's where it is critical that you have a good intervention at the start. We got to avoid things that make it worse. You have to have the right treatment plan in order to start to regress or push that disc bulge or that herniation back where it needs to be and centralize and stabilize it. And so as we look at it from the top down, those are the most common things we see. From the side, what the disc is doing, if we're looking at you from the side, this is our ability to move and be fancy with our movements, the beautiful athletics, the dance, all the crazy stuff that our body can do really stems from the fact that we have this super, super tough tissue that allows us to not only get stiff in our spine, but also flexible and fluid in our spine. And so when we see a disc from the side, we've got artery, vein, and nerve going into that tissue. And when it starts to get injured and it starts to get pushed backwards because of a bulge or herniation, we want to start to correct that. We want to feed it. We want to incorporate a good plan for your recovery. And so as we look at these things, these are, to me, critical things that you understand if you have a disc injury. If you come in and we are talking about a disc, don't think it means surgery. Often, in my experience in the clinic, and I think many practitioners' experience, disc injuries are very treatable. But you have to get after them. Don't let them fester. Don't let them linger. You have to know what the right approach is. They shouldn't get madder with care. You shouldn't have more pain as you start to treat a disc because it often means we're putting the wrong pressures on it at the wrong time. And you have to be responsible for not making it matter. Stop doing the things in your life that hurt. There are so many little things like that that we need to talk about if you're dealing with pain, and we invite you to come on in and give us a call if you have questions.